Today is World Patient Safety Day. It's a World Health Organization event and it calls for global solidarity and action to improve patient safety. This year's focus is safety in maternal and newborn care. Listening to the patient, training staff and anticipating problems caused by COVID-19 are key aspects of this goal. And I'm joined now by Dr. Thoko Makola, Director of Health Systems Data and Research at the Office of Health Standards Compliance. Good evening, Doctor. Thank you very much for joining us. So it's interesting that your office, which is focused on hospitals and clinics, not on the individual doctors, you actually go out and do inspections, I understand. I wonder if you could tell us a little bit more about what you're finding after your inspections.
Good evening, Sally, and good evening to the viewers at home, and thank you very much for having me. And yes, and just a correction there, we actually do, we do inspect health establishments, which include hospitals, clinics, but we also actually do inspect private health facility, private GPs, as well as other healthcare providers that might be operating individually. But to come back to your question, yes, we are actually a quality assurance regulator that is charged under the National Health Act to inspect facilities in terms of to check their compliance against norms and standards that have been prescribed by the National Department of Health, so in particular the Minister of Health. So the regulations themselves were actually promulgated in 2018, and they came into effect in 2019. And therefore, as of 2019, then we've started to inspect health facilities, starting with the primary healthcare services, which is your clinics and your community health centers. So that's where we are. But I think with regard to what we are finding, obviously the reports would be released. But I think it's not a secret that as a country we do have issues with regard to quality of services within the health service. But,
Sorry, just to jump in, you said you did your first inspection in 2019. Have you not released a report since 2019?
No, we have that. What I'm saying is that since 2019, that is when we had actually the legislated regulations, because we can only inspect based on the regulations that are released by the Ministry of Health.
I understand.
So we started to do that. So we have released. Yeah. Okay.
Tell me then, in a nutshell, when it comes to patient safety, which are your biggest areas of concern?
Well, let me put it this way, Sally, because I think context is very important. Healthcare services generally, and over the last a couple of decades, actually there's been quite a lot of developments in healthcare services, and that complexity in the healthcare services has meant that the issues around avoidable harm have really become quite an important issue. So in terms of what we are finding, there's still some issues that relates to staff attitudes, some issues related to areas around the infection prevention and control, cleanliness. So all these kind of safety issues are still being found. And I think with regard to actual patient safety, it is where we actually seeing that there are some patients that are actually suffering avoidable harm while accessing healthcare services that we would like to get on top of as part of dealing with the issue of healthcare services in the country.
It's interesting that the WHO puts as a really important issue that of listening to patients. And I ask that, because it implies empathy on the part of the healthcare worker and actually kindness, because patients essentially are inherently vulnerable and often frightened. We hear horror stories, and particularly with the focus on maternal care, of women in labour being shouted at and told to shut up. You mentioned attitudes of nurses. It's such a difficult thing because on the one hand we know that our healthcare workers have been phenomenal during COVID-19, and on the other we still hear these horror stories about how some patients are treated. Once you've identified problems, do you have the teeth to enforce that something is done about it?
Thank you very much. Yes, I think the issue is that obviously our role as a regulator is to actually go in and inspect these health establishments against the norms and standards. And once we find that, once we make findings, Then, of course, we do then inform the authorities, whether it is in the provinces as well as the National Department of Health, about particular areas of concern that we find during our inspections. Obviously, it is for them to then be able to sort those out. So we do actually give them information about what the issues are, but obviously we do also give them, to say, how do you deal with it, and please do inform us how you've dealt with them. And if they have not, then we are also able to then escalate the issue if we feel that certain quality of care issues have not been dealt with. So we definitely progressively, this is going to be a long journey in terms of regulating quality of healthcare services in South Africa, but we are making inroads, and we're quite comfortable that as a country we are moving in the right direction.
Yeah, there's certainly much work to be done, so it's good that there is another authority trying to monitor things and make sure that patient safety is prioritised. Thank you so much for your time this evening. That was Dr. Thoko Makola from the Office of Health Standards Compliance.